How are you?
I'm good. So there's
Wonderful.
Ryan
I'm
and
Ryan
Scott.
Huff. This is Scott Samland.
Hi, nice to meet you.
Nice to meet you.
I'm very curious about Cyrano and what you guys are doing.
Yeah, so my background, I was the executive director of a mental health clinic and CEO of that clinic for a number of years. My background's in private practice work in mental health. And so I know the conversation of detail reps
Yeah.
and all that. And yeah, we are a right tool, right job
Oh, good.
kind of fit for that.
Yeah.
A big thing with what we're doing is soft skills and reading the room virtually. And I think that's a piece where, especially the middle of the bell curve, sales reps are going to get a lot of benefit because if we can, in advance, in real time and after the fact, give an average or great salesperson just a couple of key pointers about the subjective nature of that person. And we can show you some examples of that in a moment. But the idea is we're just making it easier for them to know what pitch is coming. It's just easier for that salesperson to say, okay, here's the play, here's the strategy, and go with it. So it makes a lot of sense that we would fit there.
Yeah.
Ironically, the other side of what we really want to do is in the telehealth side, work with providers to increase compliance of the patients as well.
Yeah.
Because that's functionally a sales job, as you know, is getting a person to follow through on their treatment plan has massive implications.
Well, yes, I think there's something like 125,000 deaths in the US alone every year because of lack of patient adherence. A third of all hospitalizations, lack of patient adherence. So yeah, it's a big area.
And so our system can measure the likelihood a person's going to follow through on the thing being talked about. And we've proven that in B2B and B2C.
Nice.
And then our system takes that and then creates the strategic game plan on how to increase that likelihood. And that's basically what we do.
So that's actually got other implications as well in pharmaceuticals, because one of the other areas that always drives me crazy, but pharmaceuticals have done it for centuries, decades, was in market research. They always do this thing where they ask doctors, tell them about a drug and then say, do you intend to prescribe the drug? And then they take that as gospel, what the intent, and I always say, what you intend and what you do don't necessarily, they're not the same thing. So it sounds like you can measure that relationship between what they're actually saying and potentially what they're doing. That's pretty amazing. That's cool.
Yeah, we're looking at linguistic tells that are non-obvious, right? So the very lazy example is I want to buy a car, I need to buy a car, I will buy a car. That's a modifier. But finding the much more nuanced versions of exactly that is the first step of what we do.
Wow, that's really interesting. And I also wonder if that would have implications in clinical trials, because one of the challenges for clinicals, there's a few CEOs of clinical research organizations in my membership as well. And I was thinking one of the challenges they have is getting patients to sign up for trials. Would there be some way that this could help that process as well, maybe? I'm not sure.
What we're talking about is increasing conversion rates.
Yeah.
The answer is yes. I don't know a lot about that area, but generically speaking, yes, we can tell you how to approach a person. And we'll show you an example of what that looks like. But the idea, again, very oversimplified, is we could say, this person is data-driven. Make sure you're giving all the facts and figures. This person is process-driven. Make sure they understand the steps of what's going to happen and how it benefits them or others. This person is relationship-driven. Make sure they understand X, Y, and Z. And we do these all in a ranked order.
Yeah.
And so understanding how to put those together and really giving let's call it the physician or the detail rep, just a very simple playbook of bullet points that they can skim and then know what to do with it.
And what kind of data are you using to make that determination with the doctor? Say it was a sales rep with a doctor. How would the system, what data would you use to make that decision of what they're like?
So depending on the flow and the choreography of that sales cycle, the easiest way to do it is, if that's a multi-step sales cycle, you can take the first conversation, and then after that first conversation, a report gets generated about the people on the call. And it's not just the doctor, it's about the relationship between the two people that we're assessing. So yes, we're assessing the individual, but we're also assessing the salesperson and then meshing those.
So you could also potentially recommend which salesperson goes best with which doctor.
Absolutely. And that creates, like, you can kind of back up to where you just chunk up that level to a manager's dashboard where it's not, a random assignment or a regional assignment. It's a soft skills based assignment.
Interesting.
For sure.
Okay.
So back at the beginning of the year, we were talking to software companies, and our primary go-to-market was just having them license our API and build it into their software. When coronavirus hit and Zoom started taking off, we thought, let's take advantage of this growth in the Zoom space and see what we could build there. And we started with just essentially a proof of concept, an MVP of what we could do with Zoom and make it very consumer oriented. And so we built out what Scott can show you some output of. That basically, after a Zoom call, it takes a transcript of the call, analyzes it, and then sends an analysis of that call back to the host, right? So it says, here's how you came across, here's what you should know about the doctor, here's what you should know about how to follow up with them and things like that. So we launched that back in April or so, and we've got over 20,000 people on it. A lot of small business owners and salespeople and things like that. And we're effectively giving it away on the Zoom platform right now, again, as that proof of concept. And simultaneously, we're working on building out a bigger platform that is a kind of a full-fledged app that you would use that would pull in conversational data from a variety of sources and provide to you that really global profile about everybody that you're working with and things along those lines. So I bring that up as today you can add the app to Zoom and have it review those transcripts and send you the report, and that's totally free today. If I don't know if this is what you're thinking about or not, but we have the APIs available, and we can work with your team to figure out how to build this type of application into an existing application that your users are using. I don't know if that's a potential there or not. And then thirdly, as we're approaching the rollout of this new app, we're looking for early adopters, we're looking for pilot users and things like that. And so we'd love to get people to signed up for that and get their involvement during this process as we're building that out.
That's interesting you say that, because that's something that I've been thinking about recently, because I have been with this membership going to pharma, and they're the people, them CROs and some of their agencies are the ones that are my members. But I'm finding really innovative, interesting AI-powered tools like yours. And it occurred to me that if I start to get, just one of the pharma CEOs said, I'd like ones that no one else has. Now, most of the ones on my site, they only have one or two healthcare clients anyway. But it did occur to me that if I got people early enough that had no pharma clients, then we could do, and they were fairly early startup, we could do pilots with the pharma, with the pharma partner, so they could test it and be the first one to have it, and also give you feedback on what would make it perfect for them, which helps you develop the tool for the rest of the industry, but it gives them that first mover advantage, and you know, you could do some kind of exclusive thing for a certain amount of time for the right price, of course.
Yeah.
So
those are the kinds of things we're thinking about as well.
Yeah.
If you like, I'll show you an example.
Yes, I'd love to see it. I can't quite get my head around how it works.
It's very reasonable. So this is an example of an email that our system creates. So the nice thing about this is there's no user interface.
Yeah.
You just do a Zoom call like you always would, and then at the end of that call, you get this email.
Okay.
So it starts with this piece, which is conversational commitment, and this is how our system's able to determine the likelihood the person's going to follow through.
Mm-hmm.
So Bruce is one of our customers. Obviously, I'm Scott, and then David works for Bruce. He was only on the last couple minutes of the call. And Neil is one of our board members who made the introduction. He's just on for the last 5 minutes. So you really just see me and Bruce kind of trending through this, and you can see this kind of shared arc.
Yeah.
We actually have this broken down into 32 categories that show their mental states, but we just display 3 to make it easy to understand. But our system is measuring which states are being employed and which aren't. For example, if a person's using high emotion versus high logic, we're tracking that.
Yeah.
And the concert and harmony of all of those generates different strategies. So again, I'm this blue line. So down here, I'm this blue section. You get a little bit about me, but you mostly get stuff about Bruce because he's the person I really care about.
Okay.
And what you're seeing is these sets of priorities, communication style, and commitment level. So you can see I am community, he is data. You can see I'm visual, he's auditory, and the commitment level, I'm compelled, and he is curious. So the other ones that aren't, of these two, this is instinct and ego, and this is process and order.
Okay.
And these are not identities. These are priorities that we all use a combination of all 4 of those in all of our decision-making processes. But understanding the patterns that emerge about a person allow us to create these game plans. So the ranked order of all of these, and this is actually much more complicated than 3, but that creates this. And these bullet points are generic. We can create custom modules for different industries. Right now, we're building one out for real estate. And we have other things like how to mentor in conflict resolution, how to upsell a person, things like that we have built as well. But this is generically about the person. This is next steps, and this is lifetime value of the relationship. And right now, our system, assuming 2 people are on the call, our system can generate 24 and 28 billion different emails. So you're going to get custom responses every time. And this just comes to your email after the call. And just to point out something I think is interesting, David, who was on just the end of the call, first, he didn't say enough, so we have insufficient data about his commitment level, and our system calls that out. But also interestingly, David and Bruce had the same data auditory and curious, but the report is completely different because all the other ranked order influences it as well.
Wow. And so I guess after each call, if they're getting this, the system would also be learning with the sales guy and with the doctor each time, so the data would start to stack up, so it would get even more accurate as time goes by.
That's right. And these emails, again, this is a free solution. The emails themselves is a free solution, so it's very basic today. But the application that we're building out right now, yes, it spans the entire relationship with somebody. And then also, if you and I, I'm the doctor and you're the pharma salesperson, we're in a conversation, it's analyzing our conversation, which means it's also analyzing you as a sales rep. And so your manager and all of their sales reps, we can provide information also to the manager saying, here's how to coach your team and make them individually more effective communicators and more effective salespeople.
Oh, interesting.
And so you can start looking at success rates where you can say, sales rep B, he or she does really well with people who have a graph that looks like this, but are really lacking in a graph that looks like that. So you can either, manage to coach them up to get better at that with, tangible feedback, or you can coach around that and, just deploy people to their strengths.
So what is the difference between the free version that you mentioned and the paid version?
So, for one, as I mentioned, the email today just looks at a single meeting and gives you an analysis on that meeting. And there's no historical look back or anything along those lines. Also, the email is just based on Zoom conversations.
Okay.
The app, it will start looking through email correspondence that you've had, Zoom recordings as well, and phone calls and things like anything it has access to. It starts to build a really comprehensive profile and provide advice all around.
So any language data?
Yeah.
Okay, so you could potentially also take data from that doctor's ID to the medical information call center conversations they've had and link that in as well, so you'd get a bigger, more comprehensive picture of that doctor and their issues.
We're actually in conversations right now with a company that would allow us to automatically ingest voicemail.
Nice.
So any voicemail left to that person, you can point that to the specific CRM as well.
Wow. And does it
for social media, LinkedIn, Twitter, all those things could be ingested just as easily.
And does it link with specific CRM systems?
That's the plan. So again, we're building all of this out right now. But yeah, we'd probably start with Salesforce.com and go to other popular CRMs after that as well.
And it's worth saying at this point, Ryan is being humble. Ryan, his previous company that he started and sold was at one time number one in Salesforce App Exchange. So Ryan is very experienced in building something out into CRMs that gets mass adoption.
Interesting. Also for
I'm trying to remember the pharma
Viva.
Sales. I'm sorry?
Viva.
Yeah.
Most pharma use Viva. And so I think Viva was, I believe, started by someone who used to be vice president of Salesforce.com and then left to do a pharma vertical. Yeah.
And it's a $1 billion company by itself.
Yeah.
Which is big. Crazy. All it is, I mean, it's it was one of the first. I think it was one of the first $1 billion add-ons to Salesforce.
Yeah.
Putting it.
So I think if you're looking at CRMs, certainly for my sector, Viva would be one you definitely want to look at. Some use Salesforce.com still, but most would use Viva these days for my industry. Some in Japan have their own, that they've built themselves, but even some that I know that have their own are starting to move to Viva. So it seems to really be the main one. And then what kind of model do you have for revenue? Do you do a subscription model for the paid version?
Yes, for the application, it would be a subscription. If you're interested also in that API licensing approach, then it's still, a SaaS-based subscription, but it's something that we can get creative on pricing with.
Yeah.
In terms of the model that we want to build that pricing around. That's also a possibility. Well, good. Well, thank you for reaching out and stay safe. And we'll be in touch.
Perfect. Thank you both so much.
We'll follow up with some documentation.
Well, thank you both so much. I really appreciate it. And I think what you're doing is really, really interesting, really groundbreaking. Thank you.
Thank you very much.
Okay. Speak to you again soon.
Take care.
Bye.